morning and welcome to this press conference organized by the European Centre for Disease Prevention and Control to mark the 18th of November, the European Antibiotic Awareness Day. My name is Barbara Albiger, Head of Communication here at ECDC, and I will be moderating this event. This year's theme is Antimicrobial Resistance is Invisible. Patients are not, reminding us of the impact of antimicrobial resistance on patients' lives and on the life of their family. Since 2008, when ECDC launched the European Antibiotic Awareness Day, the 18th of November has been traditionally the day when ECDC releases the latest data on antimicrobial resistance and on antimicrobial consumption from the European Union and the European Economic Area. In addition, today, ECDC will also present updates on the progress of the European Union and the member states toward reaching the 2030 antimicrobial resistance and antimicrobial consumption targets outlined in the Council recommendation on stepping up EU action to combat antimicrobial resistance in a One Health approach. That Council recommendation was adopted in 2023. For this purpose today, we have the ECDC Director, Dr. Pamela Rendi-Wagner, and Dr. Dominique Monnet, ECDC Head of the Antimicrobial Resistance and Healthcare-Associated Infection Program. But before we open this press conference, I would like to mention a few house rules. We kindly ask you to mute your microphone during the speaker's intervention. At the end of Dr. Rendi-Wagner and Dr. Monnet intervention, the floor will be open for questions. And there is two ways for you to ask questions. You can either raise your hand to get the floor and ask your question directly, or you can write your question in the chat, and I will be reading your question. But in both cases, please, we kindly ask you to state your name and the media you're representing. Finally, I just would like you to be aware that this press conference is recorded and the recording will be released on ECDC channels afterwards. Thank you. And now I will give the floor to the ECDC Director, Dr. Rendi-Wagner, please.
Thank you, Barbara. And good morning, everybody, and welcome to our press conference on the European Antibiotic Awareness Day. Well, the Antibiotic Awareness Day is indeed an important opportunity to take stock of where we are in the fight against antimicrobial resistance. And you know, today ECDC is publishing the latest data on the resistance as well as on antibiotic consumption in the European Union and the EA countries. What we estimate is that over 35,000 people die in the European Union each year as a result of infections resistant to antibiotics. Moreover, 4.3 million patients in Europe acquire at least one healthcare-associated infection during their stay in a hospital. Many of these hospital-acquired infections are resistant to antimicrobials. And these numbers show one thing, that the problem is indeed huge. And it's also huge at the individual level, at the patient's level. AMR takes indeed a tremendous toll on patients and their families. As you will see later on in the patient stories, ECDC is launching. So today I would like to cover three important areas. First, where do we stand in the fight against antimicrobial resistance? Second, what is needed to maintain the effectiveness of these important treatments? And third, what is ECDC doing to support Europe-wide action? First, where do we stand? Well, today ECDC is releasing new data tracking EU's progress on antimicrobial consumption and resistance against the 2030 targets adopted by the European Council only last year. And you know, these targets cover more or less the consumption of antibiotics in Europe and also important bloodstream infections with resistant bacteria, as well as the use of antibiotics. Well, there has been some progress in Europe, but overall, we have to say Europe is still trending in the wrong direction. Antibiotic consumption in the European Union increased by 1% between 2019 and 2023, moving us further away from our joint 2030 target of a reduction of 20%. And while some resistant bloodstream infections have decreased since 2019, such as MRSA, others have increased by 60%, 60%. And this increase is indeed worrying, as very few options remain available to treat people and patients who are infected with these highly resistant bacteria. We can say that progress in the European Union is only as good as the sum of the progress each member state makes. So at the member state level, we see a very, very uneven picture. You will see this later on in the presentation of Dr. Monnet. And we see some countries in Europe who are making some progress more than others, and some even reaching their targets. But what we really want to tell you today is we need to make a concerted effort to harmonize progress across member states, to share our experiences, and to share solutions. These joint efforts are an important cornerstone to reach our 23 targets. So today we are calling for action once more. We are calling for action in 3 key areas. First, infection prevention and control. Second, prudent use of antibiotics. Third, promoting development of and access to novel antimicrobials. So first, infection prevention and control. Healthcare-associated infection account for the majority, 70% of AMR-related health burden in the European Health Union. So this is why hospitals must prioritize on very, very basic, but yet critical measures. First, improving hand hygiene, hand disinfection, very basic measures. Increasing the number of and the training for dedicated infection and prevention control staff at the hospitals and care facilities. Third, increasing the screening of carriage of resistant bacteria in the patients. And fourth, increasing the capacity for isolation of such patients in order to avoid the spreading of resistancy. Second, the prudent use of antimicrobials. Indeed, we must ensure that antibiotics are used appropriately. What does it mean? It means to use antibiotics only when they are needed, with the correct dose and with the correct duration. ECDC therefore advocates for comprehensive stewardship programs to promote the right choices in antibiotic prescribing. This work must happen both in hospitals and at the community level. The community sector accounts for 90% of all human antibiotic use. So we have to act there as well. So additional information and also public health awareness campaigns targeting AMR are needed more than ever. And this should be completed and complemented by social and also newly by behavioral interventions. Third point is that we need continued progress in development of and the access to novel antimicrobials. Why are these important? Well, these are essential. These are essential for treating patients with infections that are resistant to even last-line antibiotics. So finally, I would also like to talk about ECDC's extensive work to combat AMR. We're at the forefront of EU's efforts and work very closely with our partners across the scientific sectors. This includes the European Commission, the European Medicines Agency, the European Food Safety Authority. And this cooperation is called One Health Approach. ECDC also works with WHO and more with the member states. So let me tell you that next year in 2025, ECDC will support the European Commission to develop EU guidelines on infection prevention and control in hospitals and long-term care facilities. And this will be the first EU-centered standardized guidelines in healthcare facilities across the member states. Through our AMR visits, which take place on a regular level, we also support all member states directly with technical expertise to develop strong national action plans on AMR. In addition, ECDC has now begun so-called public health emergency preparedness assessments in all member states. And they are there to directly evaluate the healthcare systems and offer targeted recommendations for improvement. Additionally, through our regular surveys, ECDC provides, like today, up-to-date data on healthcare-associated infections, AMR, and antibiotic consumption in the EU and EA countries. This data enables countries to benchmark, to develop and implement evidence-based policies in their countries. This week, as you know, our huge ESCID conference is taking place here in Stockholm. And we will launch a prevention community of practice, so-called ECDC Lighthouse, which will have antimicrobial resistance at its heart. ECDC Lighthouse will facilitate sharing best practices for prevention. And finally, ECDC supports the partners and all member states in developing awareness-raising campaigns. Let me come to an end and say the battle against AMR is one we must fight all together. We all have a role to play. The policymakers, the healthcare providers, the patients, the doctors, the public, you and me. By making the right choices that protect these vital treatments, we protect and save lives of people around us, their families, the communities, and future generations. And that's what I would like to close with. Behind all this data, which is presented today, behind the statistics and numbers, there are real people, families, whose lives were affected by antimicrobial resistance. Their stories give a voice to those who face prolonged hospital stays and clinical complications due to AMR. Fighting AMR means saving lives, protecting our health systems, and our foundations of modern medicine. Thank you.
Thank you very much, Dr. Rendi-Wagner, for your very strong words and for confirming the strong commitment of the Center in the fight for antimicrobial resistance and also for infection prevention and control. Now we will hear from Dr. Monnet, ECDC head of the Antimicrobial Resistance and Healthcare-Associated Infection Program. He will go more into details into the latest data. Please, Dr. Monnet, the floor is yours.
Thank you, Barbara. So good morning. And today is European Antibiotic Awareness Day. And ECDC is releasing new data tracking EU response on the progress of the EU overall and of individual member states on their progress on antimicrobial consumption and antimicrobial resistance against these targets that have been adopted by the European Council last year and that must be achieved by 2030. There are 5 targets, 2 on antimicrobial consumption and 3 on antimicrobial resistance, and we will update you now with the progress of the member states. So the first target is about total consumption of antibiotics in humans, combining both the community and the hospital sectors. While there has been some progress, the EU overall is now trending in the wrong direction. Between 2019 and 2023, total antibiotic consumption in humans in the EU increased by 1%, moving us further away from our 2030 targets of a 20% reduction. There was a decrease in total antibiotic consumption in 2020 and 2021, which has been attributed to the effects of the pandemic that had on communicable disease transmission and ultimately antibiotic prescribing practices. There have been lockdowns, teleworking, school closures, and all these lead to fewer people getting bacterial infections. And there were also fewer visits to GPs and doctors. But antibiotic consumption began to rise again in 2022. At member state level, we see an uneven picture. As set out in the Council recommendation, there are indicative reduction targets for each individual member states relative to their level in 2019. This is to ensure that the effort to achieve the EU target is equally shared across the member states. What you see from this table is that one member state, Finland, had already reached its reduction target by 2023, and countries marked in green. There are 9 member states that are progressing towards their reduction target, and these are marked in yellow. And 14 member states showed an increase rather than a reduction, and these are marked in red. The second target tracks the percentage of total antibiotic consumption in humans from antibiotics from the World Health Organization Access Group. The Access Group of antibiotics is made of mostly first-line and second-line therapies that offer the best therapeutic value while minimizing the potential for antimicrobial resistance. The target is that 65% of total antibiotic consumption should be these antibiotics in the Access Group. And by 2023, the EU was progressing towards this target, and the percentage was 62%. At member state level, the picture is once again mixed, with 9 member states already reaching the target, 9 progressing towards the target, and 7 trending in the wrong direction. Let's move to the target on antimicrobial resistance. The first target on antimicrobial resistance is on the incidence of bloodstream infections with methicillin-resistant Staphylococcus aureus, or MRSA. The target is a 15% reduction by 2030 compared to 2019. And here we have good news. Overall, for the EU, there has been a decrease of almost 18% since 2019, and the EU already reached its 15% reduction target. However, and once again, the picture is more varied at member state level. 13 member states in green reached their reduction targets for MRSA. 2 member states are progressing towards the target in yellow, and 11 member states in red showed an increase, taking them further away. The fourth target is on the incidence of bloodstream infections with third-generation cephalosporin-resistant Escherichia coli, E. coli. The target is a 10% reduction by 2030 compared to baseline year 2019. And while the EU is still trending in the right direction overall, we're losing ground against where we were during the COVID-19 pandemic. By 2023, there was only a 3.6 reduction compared to 2019. Once again, the picture at member state level is not uniform. 11 member states have reached their targets, 2 have made progress, and 13 are going backwards. And I will conclude on the 5th target about the incidence of bloodstream infections with carbapenem-resistant Klebsiella pneumoniae. The target is a 5% reduction by 2030 compared to baseline year 2019. The incidence of carbapenem-resistant Klebsiella pneumoniae bloodstream infection increased by almost 60%. between 2019 and 2023. And this poses a growing threat to patients in hospitals across the EU in almost all member states, as these are primarily healthcare-associated infections. Unfortunately, the picture at member state level is more uniform. Most member states have seen an increase rather than a decrease. We just need to keep in mind that very high percentages of increase in countries with low incidence should be interpreted with caution, since they are based on a small number of cases. Still, we have most countries showing an increase rather than a decrease, and only 3 member states, Finland, Ireland, and Malta, already reached their reduction target. Obviously, the exchange of best practices between countries should be something that should be done to understand better what has happened in the countries that have made progress on this target. ECDC is committed to supporting member states and the EU in reaching this vitally important target. We listed here a list of what we do to support member states, what already exists, and what we plan to do. And of course, we committed to providing you with an update on the progress of the EU and of member states for reaching these targets each year for European Antibiotic Awareness Day. Thank you very much.
Thank you very much, Dr. And thank you for presenting the latest data on the updates of the 2030 targets and showing us where there's progress and where more work needs to be done. Now it will be time for questions. So as I said before, you can ask your question in 2 different ways. Either you raise your hand, I will give you the floor. If you would like to ask your question directly, please put also your camera on. Otherwise, you can put your question into the chat and I will take it for you. All right. I can take the first question to Dr. Monnet. You were telling us about the upcoming EU guidelines on infection prevention and control in healthcare settings. The question is, how will these guidelines help and how will these guidelines differ from the current practice? And the second question is, what is the impact you expect them to have on reducing healthcare-associated infection?
Thank you. We published the results of the 3rd ECDC point prevalence survey of healthcare-associated infections in European acute care hospitals last May. And we will release the result of a similar point prevalence survey in long-term care facilities in May next year. They show that implementation of infection prevention and control structure and processes, all these actions that are necessary to prevent, control healthcare-associated infections vary widely between EU member states. So the aim of the new guidelines on infection prevention and control is to bring a range of tangible benefits to healthcare systems across Europe by providing recommendation on those structures and those processes that should be put in place, and for all actors involved in infection prevention and control, with focus on implementation. The guidelines will help the member states to adopt best practices more consistently, reducing discrepancies on IPC effectiveness across countries. This will support health systems in achieving a measurable reduction in healthcare-associated infections and antimicrobial resistance by decreasing the transmission of the pathogens that cause healthcare-associated infection. And we will have the possibility at ECDC to measure the progress of member states and implementing those guidelines in the subsequent point prevalence surveys.
Thank you, Dr. Monnet. I can see that we have a hand raised. So, Mr. Van den Briek, if you are ready, please, the floor is yours.
Yes, good morning. I have a very simple technical question. Is it possible to share the PowerPoint presentation on the AMR targets for 2030 that Ms. Dominique Monnet just showed.
Yes. Give us a second.
I mean online, so that we can see them afterwards, not now specifically.
Yes, we will.
Thank you. And may I continue with another question? How would it be possible to avoid confusion on the data just published in these AMR targets? Mr. Monnet mentioned it. For example, my country, the Netherlands, where the antibiotic use is very low and the number of resistant infections also shows 100% increase in CPE bloodstream infections, which might confuse when you see the 100% mentioned in the table. How could you avoid that?
Thank you, Rinke. I mean, there are limitations on how much data we can show you. Would you please put one slide that I had prepared? Can you move on? Yes, this one. 90% of antibody consumption is in the community. And we need to consider this compartment separately from hospital and healthcare. What this slide shows is that the higher the consumption of antibiotics, and this is the x-axis on this slide, the higher the percentage of bacteria that are mostly from community infections will be resistant to these antibiotics. So this association, the more a country uses antibiotic, the higher the resistance is still valid. But then we need to do this also for hospitals, and we need to do this for the carbapenems. Can you move 2 slides further, please, Katalin? Another one. Here on this slide, we have the data from the point prevalence survey. At the top, we have the consumption of antibiotics, and we have the consumption of specifically carbapenems, and how they relate to the percentage of healthcare-associated infections with Klebsiella and the like that are resistant to carbapenems. The higher the consumption of antibiotics, or the higher the percentage that on a single day are receiving an antibiotics in hospitals in each of the member states, and the higher the consumption of carbapenems, the higher the resistance to carbapenems. The good news, and I think that's what we will be able to highlight in the guidelines, are the bottom graphs. The higher antimicrobial stewardship intensity, the higher the percentage of antibiotic prescriptions that are revised, assessed, and changed. And for infection control, the higher the percentage of beds that have alcohol hand rub at bedside, the higher the percentage of beds that are in single rooms that can be used for isolation, the lower the resistance. And this is a confirmation of the more we do with antimicrobial stewardship, the more we do with putting structures, implementing processes for infection control, the lower the resistance. Back to your question, we need to separate what affects the community outside of hospitals and what affects hospitals.
Thank you.
Thank you very much. I will then ask a question to our director. The measures that were suggested by ECDC to address antimicrobial resistance actually require more resources, particularly in regions and countries where healthcare budgets are already overstretched. What is your perspective on this issue?
Well, thank you for this very important question. But when it comes to costs, we have to see the whole picture and not only one side. We have to look at the return of investments. And this is the interesting part, because one recent and very current study from OECD published last year shows that the annual costs of antimicrobial resistance in the European Union is more than 11 billion euros. This is due to longer treatments necessary, longer hospital stays, also loss of workforce, loss of lives, longer sick leaves. All this produces costs for the member states, all due to AMR. So what I want to say and what OECD tries to say and conclude is that it shows that if you apply the right interventions against AMR, you can save money. In other words, it means every euro invested in the right interventions against AMR, which is infection prevention and control measures in the hospitals, will return about 3 euros in healthcare systems. So you have a really high return of investment.
Thank you very much, Dr. Rendi-Wagner, for those words. And those are an important reminder that there is a return on investment. I am looking now for more questions from the audience. If there are no more questions, we would like to thank you very much for attending this press conference today. And we would like to ask you to continue to stay tuned. There will be more information, more data shared during this week, during today. And with that, we thank you very much.
Thank you.